Welcome to The Explainer. Today, we are diving into a really big shift happening in hospice care. There's a new data collection system called HOPE, and it kicks in on October 1st, 2025. Trust me, this is set to completely change the game for how patient care is managed and measured.
Okay, so here's how we're going to break this down. First, we'll get into the core idea behind this whole thing. Then we'll look at the new schedule, the key moments for data collection. After that, we'll talk about the most important new process. It's a real game changer. Then we'll cover the tools that make it all happen. And finally, we'll zoom out and see why this whole thing matters so much.
So what's the fundamental change here? Well, it's a total shift in mindset. We're moving away from looking backward and toward acting right here, in the moment. Think of it like this. The old system, the HIS, was kind of like looking in the rearview mirror. It was always a look back, asking, okay, what could we have done better? But this new HOPE tool, it's more like a daily huddle. The focus is on asking, what does this patient need right now? And then, actually going and doing it. And this quote right here, it just nails it. This is the heart of the matter. This single idea, shifting from just reviewing to responding in real time, is the engine driving this entire change. It literally transforms data collection from some boring chore into an active, vital part of taking care of people. So how does this real-time philosophy actually change the day-to-day for clinicians? Well, it all starts with a brand new structure, a new map for collecting data all the way through a patient's journey. First things first, HOPE stands for Hospice, Outcomes, and Patient Evaluation. And you need to know, it's the new standard, and it's universal. This isn't optional. It applies to every single patient in a Medicare-certified hospice program. It doesn't matter who's paying, how old they are, or where they're getting care. This new structure creates a totally different rhythm for patient care. It's not just about getting data when someone is admitted and when they're discharged anymore. Now, there are up to 4 different time points. And the biggest change, you can see it right there, is the addition of 2 HOPE update visits, or HUVs, right in that critical first month. But look, just collecting more data isn't the point. That's only half the story. The real innovation, the genius of this thing, is how that data gets used. And that brings us to the biggest new process in the whole system, the Symptom Follow-Up Visit. So an SFV, or Symptom Follow-Up Visit, is basically a new safety net for patients. If, during any assessment, a patient says a symptom, like pain or being short of breath, is having a moderate or severe impact on their life, it automatically triggers the need for another in-person visit. No questions asked. This creates this really powerful closed-loop system. A major symptom gets flagged in the system, bam, a follow-up visit is automatically required. A clinician has to go out for an in-person visit, and whatever they find gets fed right back into the patient's record. It's a system that's literally designed to make sure nothing and no one falls through the cracks. And that 2-day window, it's absolutely critical. This isn't just a suggestion, it's a hard rule. And that's what turns a simple data point into a fast, real-world clinical intervention aimed directly at managing a patient's distress as quickly as humanly possible. So you're probably wondering, how on earth do you manage all this in the real world? As you can imagine, it means making some huge changes to the software that clinicians and back-office staff are using every single day. Systems like HCHB/PointCare have been totally retooled with a whole suite of new tools to handle this. We're talking brand new visit codes for these HUVs and SFVs, automatic calendar prompts so nothing gets missed, and even warning systems to stop you from making scheduling mistakes. It's all there to guide staff through this new, more complex workflow and just make sure everyone stays compliant. And to actually capture all this new information, clinicians are going to see new and updated sections in their software. Just look at the addition of symptom screening right at the top. That's a brand new, dedicated section that directly plugs into that proactive philosophy of HOPE. It's there to make sure this critical data is captured at every key visit. Okay, so let's zoom out for a second and look at the real-world impact of all these changes. We're talking not just about measuring quality, but about the actual financial health of hospice organizations. Yeah, this isn't just about collecting data for the sake of it. Starting in 2028, all this HOPE data is going to feed in to 2 brand new public-facing quality measures, and they are going to specifically track how fast a hospice responds when a patient says they're in pain or having other serious symptoms. And yeah, the stakes for getting this right are really high. Hospices that fail to submit at least 90% of their required HOPES data on time, well, they're facing a 4 percentage point cut in their annual payment update from Medicare. And that is a huge financial hit. So When you put it all together, what HOPE really does is reshape the very definition of what quality means in end-of-life care. It pushes past simple box ticking and ties a hospice's public reputation and their funding directly to how proactively and how well they manage their patients' symptoms.
And all of this leaves us with one final thought. This shift from looking back to acting now, it's incredibly powerful. And as we see it about to transform hospice care, it kind of makes you ask the question, where else in our healthcare system could this kind of real-time, responsive approach make the biggest difference for patients?